All right, Dr. Brett here at Delta Health, and I want to introduce you to our practice here a little bit. Again, hopefully your experience so far has been great. This may be your very first time. This may be you coming back. This may be you're just sitting there with somebody that you're tagging along with today. Either way, welcome. I want to give you a little background on this practice. The practice was started over 15 years ago, 16 years to be exact now, back in 2008. And it was just founded on quality patient care. And it was a small practice with myself, part-time staff person when we started. It's kind of funny looking back at that now. Long story short, we've added a lot of providers over time. We've added more staff with the simple focus is getting you what you came here to get. And really, we rebranded a couple of years ago to take the Delta name on. And the reason behind the Delta that we all kind of gravitated towards was just the fact Delta stands, it's a Greek symbol for change and for something different. And truly, our healthcare system has struggled in the last couple decades really to deliver a high quality level of care. And chiropractic, functional medicine, massage therapy, all these things are termed as alternative forms of healthcare. The change we want to make is these starting to become a primary form of healthcare, your first stop rather than your second stop or your last stop for that matter on there. So that's really brought us together. And really our goal is we make the process simple. We make it enjoyable for you. And bottom line, get the results that you came here to get. That's why you're here. You didn't come here to hang out with us. As fun as we are, as cool as we are, that's not why you're here. So we know that. And I think the thing to understand is like even how this model's set up, like most providers in this practice are their own boss. Everybody in here from a chiropractic perspective owns their own business. And we participate as a co-op together to provide service. In other words, it allows our providers to focus more on you. That's the goal, is that when they focus more on you, you get a better experience, you get a better result. We're all happy at the end of the day. So that's the uniqueness about our model here. A little bit about our providers. I'll just go down the list here, honestly. Dr. Jeff has been with us for quite some time now. He specializes in a lot of like acute type injuries on stuff and rehabilitative type things like disc injuries. People have been to surgery or contemplating surgery. Any complex things, a lot of times he just licks his chops at because he's got a really intense background on studying the spinal biomechanics, basically. So great resource with that. He has a lot of patients as well, too, that just their general well-being that are here. So that's Dr. Jeff. Dr. Lydia, she focuses a ton on moms and kids, mothers that are pregnant, newborn babies, kids that are perfectly well, kids that aren't so well that need some help, moms that are struggling after birth process as well too, and family care. She has a lot of specialized training in working with kids and pregnant women, some things that a lot of us don't want to do on there. So she's an awesome resource with that. Dr. Rachel is our functional med provider in here. Functional medicine is a little bit outside the box for a lot of people, but anybody that's tried it knows how valuable it is. And functional medicine is ultimately using food and supplementation and lifestyle factors to be your medicine versus taking medicine pills per se and shots and all the other stuff that goes along with it. She is very, very knowledgeable, easy to communicate with, gives you direction and helps create some accountability for you to help you get what you came here for. I would encourage anybody to take the time. She does a 20-minute consultation at no cost. Sit down with her, find out if it's something that can help you, period. Really, really simple with that on there. Dr. Cassidy, another chiropractor here. She's been here the last couple of years as well, too. Her focus is really a lot of rehabilitative stuff, a lot of spinal and soft tissue rehab type stuff, whether it's shoulder stuff, knee stuff, things like that. She does things like dry needling. She does things that break up a lot of scar tissue in there as well, too, with it. There's things that she does that's not comfortable, but gets awesome results. It's a great complementary thing to just chiropractic care by itself as well, too. So a lot of patients that see other providers also see her as well, too. So again, it gives you a general background. And then we have a team of massage therapists as well. And Brittany's our lead therapist, been with us for 10 years now, actually. And they all do things a little bit different. But the focus we have with massage in this practice is that it's therapeutic. It's not a spa, it's therapeutic. You came in here to get something better or to stay well. We don't want you just coming in here to take a nap and listen to soft music type of thing. We want you in here because you want to get a result from it. So again, that's what our massage is focused on. We have membership options with that as well too. It keeps it very affordable. very accessible as well too, and you can try different therapists. That's the great part about it, to find something that it is that ultimately you're looking for. So with that being said, with you just starting now, whoever provider you're with, ultimately at the end of the day, I want you to understand what to expect. And what you're going to expect is this first visit, they're going to go through an evaluation process with you, a consultation piece. They're going to ask you questions, going to find out what's going on. We want to know why you're here and what your goal is and kind of how you got to this point to begin with and how can we help. And even in some cases, if we can't help, we want to get you to the place where you need to get help at, type of thing. So that's step number one with that. Many times in that first visit as well too, they'll do a little bit of work with you to see how your body responds to it. Follow-up wise is really critical, and that critical piece of that it's done quickly. We as providers need to learn something from what we just did with you based upon you came in here, you got somewhere here, and how your response is based upon that gives us direction in terms of what we're doing moving forward. So that's step number two. That's that second visit. We're going to sit down, ask a few more questions, recheck things out. It takes about 10 minutes is all. It doesn't take a lot of time. And then from that, we can kind of build together a little bit of direction based upon what you want to accomplish with this. And that's a really, really critical thing, is that we're here to help get you what you want, not what we think is in our best interest. We're not going to high pressure you into anything. We're not going to tell you chiropractic is the only way, end all, be all the things. That's not how we operate here. We're realists in this regards. We know you're busy. We know you got a lot of stuff going on. We know that this is not the only option with this. Chiropractic is a great tool, as is functional medicine, as massage therapy, but they are not the end all be all with it on there. So understand this. What we will tell you though, in that second and that third visit is where we really give you some direction on stuff. And it's really critical to get to that point so that you truly know the direction on it, as well as how much time is it going to take? What's it going to cost me? How's my insurance work with this stuff? Those are all questions we answer in that third visit on there. And what are my options? We want you picking an option that works for you based on what you want to accomplish. So understanding those things, though, is that we're also going to give you direction. You pay us not just to push on you and move things around and tell you random stuff. You pay us to be experts at what we do, to give you direction. If we don't give you that direction, we're failing you on there. It may not always be the thing you want to hear, but it's one of those things. I want you to have the information and knowledge to be able to make an educated decision for yourself or for your kid, to help your spouse, whatever those things are. We want you making decisions based upon all the information, the right people involved, the options on the table, so that you can figure out where you go. That's how healthcare is supposed to be. That's the Delta thing again. This is not about strong arming you, pushing you down a path. It's not about shoving something down your throat that doesn't really fix the problem. It's about giving you knowledge and information and the ability to choose what path makes most sense for you. So that's a promise from us to you, is that we're going to give you that. We're going to give you the ability to make that decision. So again, I'm done talking. Welcome to Delta Health. Enjoy your experience here.